Welcome to The Spine Guy. I'm Dr. Brian Su, a fellowship-trained spine surgeon. The Spine Guy is a channel dedicated to making the complex spine simple for patients to understand. Today we're going to be talking about the Saunders Cervical Traction Device. Many of you have asked about how to use the Saunders Traction Device. This is typically used for cervical radiculopathy. As a reminder, cervical radiculopathy is when you have pain in the distribution of a nerve that comes down your arm. And that usually happens because of a bone spur or disc herniation that's pinching the nerve. So there's two ways to get rid of the pinching. The first is to take the pressure off the nerve, which is surgery, which is what I do. And the second is to take inflammation off the nerve temporarily, either by doing an epidural or taking medications, or doing something like home cervical traction. So cervical traction pulls up on the neck, provides a little bit of space for that nerve to take inflammation off the nerve. Traditionally, people would hang weights with a towel under their neck or under their head, and to me that's not safe, it's uncontrolled. So this is a terrific device, and I have with me here Jamie Cunha. Jamie Cunha is a certified physical therapist, a doctorate of physical therapist. She's one of the best therapists I know and has treated many of my patients with the Saunders Traction Device for cervical radiculopathy. So Jamie, tell us a little bit about the device, tell us its function, and how you might tell a patient how to use it.
Sure. So the device looks like this. It's pretty simple. Most of them come with a strap that can go over your forehead that has a Velcro closure. So that's missing from this device, but will usually be on the ones from home. There is a neck cradle here and some knobs that help you rotate and bring the cradle a little bit tighter as needed or looser. Your head goes here and you can adjust the height depending on comfort and bring it down or up at an angle.
So does it matter, you know, sometimes we have people that have problems at C2, C3, C4, C5, C6, C7, etc. Does it matter what angle you're using it at, the 15, 20, or 25, or is it just whatever's comfortable for the patient?
Typically what happens is we try it in physical therapy here, so we will often figure it out with the patient.
Right.
What's the best setting for them, and that way they can bring it home and they don't have to play around with it.
And when I see a patient with a pinched nerve in the neck with cervical radiculopathy, I will write home cervical traction trial at physical therapy. The patient will go to the physical therapist. Somebody like Jamie would see the patient, put him in this. And I do that, at least in the US, because if it doesn't work for the patient, I'm gonna make them go out and spend $400 to buy a device. If it does work, they go out and buy it. And sometimes if it does work and their insurance is such, I can write a prescription with your supporting note, and then the insurance pays for it. So that's another advantage of trying in physical therapy. So yes, you can do it on your own, but I think ideally having a therapist show you first would be great.
There is a knob here, and you basically you go from release to pump to hold. And so what happens is when you release it, everything comes down. When you go to pump, you can pump it, and then you can see it starts to give some gradual traction.
So the head is here.
Yep.
The neck is here, body is here, as you'll see later.
Yep. And then when you find the right level of traction for yourself, which is just a strong but comfortable stretch, you turn it to hold and it'll stay there. And you just rest, try not to move around. And usually we start with 10 minutes just to make sure that everything feels good after. And then beyond that, if you want to do 15 minutes, that's great. 10 to 15 minutes is usually what we recommend. And then at the end, you just go back to release. And it'll come back down, release the stretch. And as needed, again, you can loosen it and just get out of it.
And this goes up to 50 pounds, and a pound force is basically hanging, for example, 5 pounds will be getting a 5-pound weight, putting a chin strap on, throwing it over the door. This goes up to 50 pounds, it's a lot of weight.
Yeah.
You said whatever's comfortable for the patient. What is the average pound force that's usually good for a patient?
So most people are somewhere between 10 and 20 pounds.
You said 10 to 15 minutes at a time. Better done in the morning, better done at night? Does it matter what time of the day you do it?
Well, it doesn't necessarily matter what time of day you do it. Generally, people do it in the morning, and it kind of sets them up for a good day without as many symptoms. You can do it again in the afternoon. You can do it again in the evening.
So there's no such thing as doing the cervical traction, the Saunders, too many times during a day?
Not that I'm aware of, although we tell patients, usually we tell them 2 times a day.
That's what
max.
I tell patients. I usually say twice a day.
Yep.
But I think doing it a few more times isn't a problem. I wouldn't advise doing it every hour.
Right.
Nor is that practical, but I think 2 to 3 times a day is very reasonable. And if you go longer than 15 minutes, is that an issue? Could you cause damage to the neck?
I don't think that this device is strong enough to really damage anyone. I think it's more if you're very sensitive and it's not providing as much relief and you just keep trying it and keep trying it, I guess it could irritate.
So why don't you show us what it looked like? Let's say you're at your home, this just came out of the box.
Okay.
What are you going to do to do cervical traction on yourself?
Okay. So I'm going to position it this way because I'm going to be lying down.
And always at home you would do it like on the carpet or the floor.
Yeah, you can
You would do it on the soft bed.
Right. You would want to do it, usually I'd have you roll out a mat, like a thin yoga mat on the floor. Put this down. Often here we'll put a towel or a pillowcase underneath it just because whatever you're lying on, if you're concerned about the surface, you might want to put something underneath it. And so I'm going to go ahead and lie down and get myself set up.
We'll put the gauge over here, I guess.
Okay. So first thing, you're going to lie down. Then you're going to play around with the knobs and try to get a nice grip on your neck that's not super tight.
And this is going in and out this way.
Right. Yeah. So I'm bringing those knobs closer because my neck is skinny, I guess. The next thing you would do is if yours has a Velcro forehead strap, you would just take the 2 straps, wrap it here, let the Velcro hold your forehead down. We don't use that here. And then you're going to go ahead and grab the dial. I'm going to take the dial and I'm going to go from release to pump, and then I'm going to go ahead and pump. And now it's gripping my occiput. So now I'm getting a nice stretch, and I'm probably going to go a little bit more.
So you're going pretty slowly. This is not like a bicycle pump where you're just...
Right. And it moves very slowly. I think a lot of people get afraid, but it moves nice and slowly, so you don't have to worry too much. And so I'm right now about 11 pounds or so. I'm feeling a good stretch. It feels good. I could go a little bit more. And that's about good. I'm close to 15 pounds now. And so now I'm going to rotate it to hold so that it won't move. And I'm just going to put the handle down and take a rest and just try to relax and, not have my neck tensing up, not have my jaw tensing up, and just try to relax into it and not move around very much. If you move around, it's going to change the settings. And that's about it. You just rest for 10 to 15 minutes. And then at the end, you just turn back to release, and now it's just releasing.
So now it's coming back down. It's hard to see, but it's coming back down.
Yeah, so the tension's completely off my neck, and at this point I would just un-Velcro the forehead strap, and if needed, turn the side knobs to loosen.
So you can get up.
And then you can get up.
So there you have it. That is the quick Reader's Digest version of how to use the Saunders Home Traction Device.